All right. Hi, my name is Kimberly Gervais. I am here today to give you a rundown on what's happening in the cardiac stress lab here at Brandon Regional Hospital. We, over the past couple of years, the hospital has grown dramatically, and um, the hospital has gotten a lot busier. There's increased volume. We have a lot more physicians that are here at the hospital now. And it is having some strong effects on our cardiac stress lab, as other departments in the hospital as well. I want to just present to you today an idea that we have to restructure the stress lab to make it a little bit more effective, um, because we currently are not meeting our productivity standards, and we need to be able to pull one staff member off of our schedule in order to make productivity happen. And I think we have found a way to do that. And I want to share with you that today. So I'm going to share my screen here with you. Give me just a second. And I hope that you can see. All right. Let's go into the PowerPoint here. And so to talk about our cardiac stress lab restructure, we are, as you know, as a hospital, reevaluating a lot of our processes and procedures that we are doing now. And a lot of this has to do with the new Affordable Care Act. Our observation status patients really need to be discharged within the 24 hours from the time that they are admitted into an observation status. This really causes a lot of crunch time for the ancillary departments, such as the cardiac stress lab, the echo lab, any kind of ultrasounds, any CTs, and to get the patients through and to get all the tests read in a timely manner, and then be able to have a discharge patient in 24 hours. So, and with the increase in volume, this is actually leading to staffing shortages. Even we are lacking a little in equipment at times, because there are so many patients, and we have not grown as the volume has grown, as far as staffing, as far as the equipment that we have to use. So therefore, there are extended wait times on that. So the reasons for this restructure is basically the patient volume increase. It's actually 10% over prior year, which is a lot. We have actually about 5 new cardiologists on our medical staff, which are creating more demands to the stress lab, and actually to all the other cardiac departments as well. But some of these cardiologists are independent practitioners, so therefore they don't have partners to share their responsibilities, and they're putting more demands on the stress lab because they can only be available at certain times of the day to be present for the stress tests. So it limits the schedules to accommodate the cardiologists and for the patient volume. And there's just not enough staff to accommodate. So how can we extend the staff that we have currently to maximize the skill sets that they have to make a better work process for our cardiac stress lab? That is the department that is really struggling right now to meet productivity and to meet the demands of the patient volume. So the recommendations that we are presenting today are for, we want to eliminate the full-time EKG position. And we'll go into this a little bit further in a little while, We have Maddie Figueroa, who was currently the full-time EKG tech, and she has recently retired. So it leaves us a perfect opportunity to change her position that she had for 20 years and to add another position in there that can actually fulfill more duties and use a higher skill set for that one FTE that we are allowed for that position. So in place of this, we want to create the full-time cardiac technician position. This will actually give us a little bit more help in the stress lab and the EKGs. And we want to update the cardiac stress lab hours of operation. We'd like to open at least an hour earlier to accommodate some of those physicians that are struggling to make it to their clinics in time to see their patients. And we would like the nursing departments on the floors to be responsible for the stat EKGs. And we'll go into that a little while and why there is an importance in that. EKG versus the cardiac tech. The EKG technician for many years has been very valuable to the hospital, but this position does only perform EKGs. So it limits the other skill sets, doesn't offer a lot of additional support to the nursing staff of the stress lab. And the EKG tech and the stress lab are considered one department. So it's better to have skill sets that can help pull weight in all areas. There's no certification required for that position. She did answer the phones a lot and help out in the department that way. And she was the super user for our NEWS, which is the electronic medical record for our EKGs. EKGs need to be read within 24 hours of the time that they are acquired. Mainly, they are done in the ER. So a lot of the administrative duties, she did there at her desk. And her pay rate was between $10 and $13.75 an hour. Cardiac technician, they have multiple skills. They have certifications. We would prefer the cardiographic technician position. It's called a CCT, and it's a certification through the Cardiovascular Credentialing International. They have their BLS, they can have their ACLS, multiple skills performing EKG, stress testing, and halters, and downloading the halters and getting them ready for the physicians to interpret, which actually can take hours because they have to do, they actually have to go beat by beat, 24 hours. So it takes a long time to download a halter, and previously the RNs were doing that. And they would be the super user with the administrative duties for NEWS, a complete full usage of the FTE as opposed to the EKG technician, where really her responsibilities were only fulfilling about a 4 to 5 hour day. There is a little more of an increase in pay for this position, but it would be well worth the money spent to have the extra skill sets and extra support for our registered nurses in the stress lab. So after we did some analysis on the EKG position, it does look like there was an average of only 8 EKGs being done daily on the floors. A majority of the EKGs, about 130 of them, approximately are probably done in the emergency department by the paramedics. So EKGs only take 10 minutes to perform, so it doesn't take a lot of time. They just hook up the wires and press a button. It does not take a lot of time and not a lot of training involved. Her administrative work is about 3 hours or less, depending on how busy the emergency room is. And if we can actually get the emergency room to be a little bit more effective in entering inpatient information correctly into the NEWS system, it would reduce that administrative time. So that's something that Lisa Martini-Bach and I are going to work with the VP of Emergency Services on that. And they cannot assist in the stress lab because they don't have the certification or the training to monitor patients during the stress tests, and they're paid for 8 hours, and they're not utilizing the 8-hour shift and we were negative in productivity, so we just don't feel that we want to replace this full-time position. The cardiac technician, they have multiple skills. And what's great about this position is that they can go back and forth during the day. They can work in the stress lab. The Muse station, workstation is right there next to the stress lab. And they can be working with Muse throughout the day. They can go to the floors. It does not take very long to perform the EKGs. The only problem is that we need the stat EKGs to be performed by the nurses on the floors. The nurses on the floor most of the time perform the stat EKGs after hours, which is after 3:30 p.m. until 7 a.m. until the EKG tech comes in anyway. So if we can just make it consistent and have the nurses always perform the stats, because the cardiac tech cannot leave a patient in the stress lab to go do a stat EKG on the floor. So she can't be two places at once, so that's going to have to be a compromise in order to make this happen. Their certifications, BLS, and I don't have ACLS on here, but they can have that. It's an additional certification that would be beneficial in times of a code blue. The pay rates, I have a stress tech in here as well as the EKG and cardiac tech, because we do have stress techs on our schedule, and that's what is actually pulling down our productivity. We are having an EKG tech, we're having a stress tech, and then we're having 2 RNs. And our productivity does not allow that extra stress tech because it's a PRN position that we're just scheduling because we don't have enough support. So we could, I don't know. I think the best solution would probably be the cardiac tech. The median average salary hourly rate is $17. Again, it's a little higher, but it's well worth the money that we would be spending on this position. The benefits of doing this, we are going to improve the stress lab workflow. This is important for the hospital. This is going to help move out these observation patients and move them out through the stress lab a lot faster. We have extra help. We have extra help to transport, to hook up. The patients are the lab can open earlier to allow patients to come down for testing earlier. All around, it's just going to help the workflow. It's a reduced workflow on our stress lab nurses. They're overworked. They don't have enough help, and this position can offer them assistance. It definitely will increase productivity. We've done a 3-week trial on this position now that Maddie has retired. We have Tara Lee McCabe working it right now, seeing if it is possible to work the stress lab and the EKG portion of the job, and she is doing it fabulously, and it is working on all sides of the board. We have increased our productivity. We're positive that things are getting done better. There's just a better flow. We have reduced man hours because we have one less person on the schedule and actually doing more volume during the day. So it really, we have already seen the benefits of actually the trial run that we're doing on this position. We really feel that the FTE, the full-time employee, will have a better usage of the 8-hour shift. Definitely a more effective process for the stat EKGs as well. The patients will benefit from that. The nurses need to be paying attention to their patients and what's happening to them on the floors. If physicians are ordering stat EKGs, it's because there's a change in patient condition, and the nurses need to do those EKGs on the floor. Every floor of the hospital has an EKG machine. We have 16 EKG machines sorry, throughout the hospital for these nurses to be using. So the resources are there for them. Here's the 3-week trial. There's the man hours. Our daily units of service has gone up dramatically. And as you can see, the productive hours, we were negative, and the last 3 weeks we've gone up. Again, the challenges of our restructure are going to be enforcing the new policy on the stat EKGs. The nursing staff, they are overworked too. And so it doesn't necessarily have to be the nurse on the floor to do the EKG. We have certified nursing assistants that can be trained to do the EKGs as well. And the other challenge is going to be getting human resources to actually create this position and to give a fair compensation hourly rate. HCA has been known to just be a little under the competitive rates, and I really need them to focus on the skill sets and the certifications of this position to offer fair competitive rates for the additional work this position is going to be performing. And to follow up, we are going to be reducing the observation hours, which right now we many times we have observation patients going over that 24 hours into 30, 40 hours sometimes. We're hoping this will help reduce that. We can accommodate our physicians or cardiologists who really struggle throughout their day to meet all the demands of their patients and their office patients. And this will help them. It'll help physician satisfaction. It'll help employee satisfaction. It will help patient satisfaction. Everything will just be moving faster and in a better workflow. And it's going to reduce the work on the stress lab on registered nurses. They're really struggling right now. They just don't have enough help. There are going to be times where, you know, they're doing 18 stresses, tilt table, and then they need to go over into the echocardiogram laboratory and assist with the transesophageal echoes, which can be sometimes 2 hours out of their day. So this will really help the workflow of the cardiac stress lab, offer assistance, and actually we've already seen positive results. I have references here, and we've done interviewing, a lot of backup from current credentialing websites, and I conducted a few interviews throughout my research. So I hope that you have all enjoyed. Sorry, now I'm back. I hope you've enjoyed, and I wish I could answer any questions that you might have. You can call me at extension 6031. Ask me anything that you would like. Feel free to come and talk to the cardiac stress nurses, observe our workflow. We would be happy to answer anyone's questions. So thank you, and I enjoyed sharing my information with you.